Hi everyone, my name's Natalie. I'm the manager of the practice development team with the Western New South Wales Primary Health Network. I'm based in Broken Hill on Woolly country. And we have our webinar today, Digital Health Technologies, My Health Records, Secure Messaging, ePrescriptions and AI, which is brought to you by Katrina Otto. Um, I would like to begin today's meeting by respectfully acknowledging the Aboriginal and Torres Strait Islander people as the traditional custodians of the nations and countries on which we work and meet today. I pay respects to past and present and extend recognition to all Aboriginal people present in today's meeting. Thank you. And now just a bit of housekeeping before we start. If you have any questions, can we please type them into the chat box, which you will see on your screen. We will monitor that and do some questions as we go, or perhaps at the end. How would you prefer to do that, Katrina? Just wait till the end or ask
Oh
us?
no, I want this to be really interactive.
Okay, I'll keep an
Actually,
eye.
you could all type in there now, what type of practice you're in and what your role is. That would be great.
Great, thanks, Katrina. Just in case you didn't know, the session is being recorded and we will place it onto our website. So it will be a training resource that can be used over and over again, which is really huge value. If you are viewing as a group on a shared device, can you please type in each viewer's name into the chat box so that we can record your attendance and provide you with a certificate? And on that note, I'd like to thank you all again and hope that you enjoy the session. Before we hand over to Katrina, I would like to just introduce Katrina as a nationally respected healthcare consultant, educator, and speaker, passionate about improving healthcare systems for teams, clinicians, and patients. Katrina is the founder of Train IT Medical. She draws on 30 years' experience in practice management, education, and digital health. As an approved trainer for leading organisations like the RACGP, APNA, AAPM, and the Department of Health, Katrina is known for her engaging, down to earth style and ability to make complex ideas clear. Her sessions focus on practical strategies to improve data systems, workflows, and team culture, with the ultimate goal of better health outcomes for patients and a happier practice for staff. So I'd like to hand over to Katrina now, and I'll monitor the chat box and enjoy. Thank you.
Thank you, Natalie. Hi everyone, I'm Katrina Otto. It's lovely to be here today. I'd like to acknowledge the Gadigal people of the Eora Nation on this land we call Sydney, where I am working from today. I feel like I'm with you, so I want you to feel like that too, and I want you to talk to me and write in the chat as we go along because this session is completely for you. It is about digital technologies, but everybody is on a different place in that journey. So let's talk about that and see if there's anything that, we can spark improvements for your practice. As you heard, I've been working for a very long time. I think I've been working in healthcare for 30 years now. And my goal is always to go, okay, well, what's next? I was one of the My Health Record trainers when we introduced it all those years ago. And just, having worked since we just had paper, like probably a lot of you, I've seen a lot of change. So the goal is always making sure that the change is an improvement for you, right? And an improvement for your clinical care and patient engagement is sort of top of my priorities when it comes to implementing change as well. So we're going to be talking about, are you already embedded with My Health Record use? If not, let's talk about barriers. Let's talk about electronic scripts and what's next. How AI technologies. So maybe if you write in there, thank you to those people who are telling me where you're from. That's really helpful. There's a lot of general practice focus in my life. So if you're not in a general practice, tell me what type of practice and I can contextualize digital health improvements for you. And tell me if there's something in particular that drew you to this webinar today. If you were thinking, I really want to hear about AI, I'm hearing that a lot these days, or I really want to talk about what's happening with secure messaging in our region, let me know. Because I can talk for 3 days straight. So it'd be good to know if I can make this of the most help for you all. Now, when it comes to electronic efficiency, I use this term really broadly. Paperless, right? Who's got a paperless practice? Just give me a Y or an N. You got a paperless practice or paper light, perhaps? Are you using e-prescribing? E-prescribing is, are you nearly paper light? It's a dream, isn't it? And we'll talk about why, what these barriers are. So tell me your barriers. Now, who's using e-prescribing? E-prescribing was the easiest change in my whole 20 years of implementing digital technology improvements. It was the easiest change because there was maximum benefit. Okay. And it was simple. So let's talk about the barriers to change. And when it comes to implementing change, that's where we're going to end up today. We need to preempt the barriers and then understand how we can get past those from a team perspective in our practices, but also patients, right? We'll talk about my health record, electronic ordering of pathology. So this is all just what I think about digital technologies. I think about all of this. And at least if we're not receiving everything electronically yet, at least let's print to PDF so we don't have the paper, right? And then securely emailing, using internal messaging within a practice so that you're not using paper. And secure messaging is, of course, that ability to send from clinician to clinician. So it's your digital signature with your HPII, you're logged into your clinical software and you're sending from one clinician to another. That is the goal for us all. And of course, this has been a long path to get there. We've got a lot of improvements. I bet you're getting your results electronically. So what we would need is every result electronically, right? Every piece of correspondence. So we're just making continual improvements. One of the aspects of a practice life with electronic efficiencies is consent forms, right? Registration forms. So things like QR codes so that patients can complete them electronically. And then whether that goes directly into your practice management software or whether you download it and you import it. And that brings me to my favorite topic, artificial intelligence. And this is where I want to just share with you some of the tools I'm seeing, which are taking those PDFs or those scanned documents or those electronically received emails, and they're automatically filing them away in your best practice or medical director or whatever software. Now tell me in the chat what clinical software you are using in your practices, please, because I am a best practice and medical director trainer. I have been training both of those for decades. So let me know. There he is. Hey, Brenton. Let me know if this is, best practice, best practice, best practice. I'm seeing communicate. Oh, wow. You have a brain like I do. You're working with medical director, best practice and communicate. So it's like, I need to know how this works in all of those practice management systems. Okay, wonderful. Well, I've got best practice on my desktop here, so I might flick to that at times. And then just to, this is what's on the horizon. Electronically receiving consent forms is fabulous. We don't want, to be signing and scanning. And then, of course, we're going to be talking, mid-year about electronically signing those Medicare forms and what we call the assignment of benefit. So this is just all on the kind of roadmap of digital technologies and efficiencies. And hopefully these first two, I'm hoping these first two are very much part of your normal now. So if not, let's talk about why not. Hit me with your barriers. I was the My Health Record trainer for many years. I trained it around Australia. So barriers I'm good with that. I live in the real world. I understand we don't have perfect. Hit me with why this may not already be embedded. And of course, if you are in general practice, you get paid to do this. I call it money for nothing. Cheeky, I know. But the reason I call it that is because we are supposed to have an up-to-date health summary for our patients. That's part of, clinical quality clinical care. And by that, of course, we mean allergies, medications, past history, immunizations, and are you Aboriginal and or Torres Strait Islander? We're talking 5 key data for optimal patient care and sharing of that information across the healthcare team who are looking after patients. And so maybe just give me a yes or a no in the chat. And thank you to everybody who's telling me that you're using best practice and medical director and communicare. In the chat, let me know, is my health record part of your normal? And how I see that most effectively working is every time you do a new GP, CCMP, do a new health assessment, every time you have a significant change in your patient's health, you're updating that in your practice management software and you're uploading a shared health summary. Okay. Now, the other aspect of embedded, of course, is if you do not receive something directly to you, to your inbox or your holding file or your email, are you accessing it from the patient's My Health record? Okay. Now, this is where I've got some good news. I have been training registrars this year across Australia, and I have heard them say, I use My Health record at the hospital all the time, all the time. And I'm like, this took quite a few years, but what they're saying is that it's helpful. So does anybody access My Health record to get a result that you didn't get directly? Because if not, that's the go-to place. And I want you to see how my big yellow highlighted. Can I share? I won't say who it's from, but I'll just share what you've said, if that's okay. I use My Health record when a client is new or has been traveling and I'm needing information. It has been useful. Thank you for that feedback. The more we share our stories of benefit, the more those who aren't using it regularly will start to think of it. And this is highlighted in yellow, and this is very personal. I am a carer for my 87-year-old mother who has dementia. So advanced care plans are part of my world. Multiple people accessing information like medication history is part of my world. So having up-to-date, accurate information for a person who cannot tell their own story and who does present to hospital, and those doctors need to know. So this is where I am pleased to say that we can upload. We've always been able to upload our own, like I uploaded the advanced care plan years ago. Now the general practice can upload advanced care plans as well. So this has been a long path and it's continually improving. And I just wanted to talk to that and talk to the fact that, we're talking really 1.6 billion documents uploaded. So, and, I kind of often work in the US as well. And the people I talk to can't believe that this is free. So that is about My Health record. We have all of the cheat sheets. You have a wonderful PHN team supporting you. Reach out if you need help at anything I'm talking about in this session today. But I just popped a couple of screenshots in, like being able to see the medication views and then these filters. So there's the advanced care planning, and these little filters are where you're going to want to go. And I have to say, it is still the easiest way to see if a patient has had an item number billed elsewhere, if they are registered for my Medicare. So the clinicians with access to this, it's still the most efficient. Okay, thank you. And I got feedback. Safe script is also useful and necessary. It is different in different states. And yes, the script information here is collected on my health record. So filtering, and because there was so much, they've given you these overviews where it's a snapshot of that information. Really important, I found training this, is that you change the dates. I've often had people say, there's never anything there, and they've been looking at the last month. Okay, so we could talk about this all day, but I want to not. I want to move on. So the filters are really important to enable you to be able to see things, and you can even, this is medical director, but you can even set that filter so that it's automatically looking at 3 months or longer. So consider all of those use cases. But the main thing is, if you don't have information you need, you don't have a result, you want to see when's the last time they had that test, that's your go-to, or your MBS items, that's your go-to. Now, I wanted to, this is my big scary be prepared sign. I just wanted, I'm sure you know this already, but just in case, and when I say I'm sure you know this already, it's because I know your PHN did a webinar on this, patients having access to their own results. So go and watch that if you missed it. But I, as a carer, I use 1-800-Medicare. I can access my health record, my elderly mums, my sons, and because I am a guardian, I do it respectfully. Would only be if I needed to, because he's older. So this is where, you know, just between you and me, I don't love the name. It's very confusing, but this is the My Health Record app, and patients can have access to, of course, that information that we were talking about, the shared health summaries, event summaries, results, discharge summaries, and results, except in the case where there is a higher sensitivity. It is now shared immediately. So tell me how you feel about that. How do you feel about your patients seeing their results on My Health Record possibly before you've had a chance to make that appointment? Because I know how busy you are. And I think I would just say, because I, not shy in sharing my opinion, I would say that how busy you are is a factor in how we should look at that. A lot of people express concern to me, and I say in our practices, and I was a practice manager for over a decade, it is up to us to prepare our patients by helping them understand what our whole pathology ordering system is and what's going to happen when they have that test and the results come back, how we would contact them, what the process is. And yeah, part of that now is realizing that, you may see this result before I've had a chance to explain it. Please know I will see it. If I am worried, I will contact you. This is our process. So that communication, reinforce it on your websites, reinforce it with your confirmation text, however on your Facebook page, however you communicate with your patients, including them as part of the process and the conversation will be a really important step for improved safety. But also, as a practice manager, I just find if we tell people what we're doing and why, they're a lot less likely to be upset or possibly complain about it. So know that there is a whole lot of information, including advanced care planning. And I put all this in the PowerPoint just because I will share it with you. How to upload from best practice to My Health Record. And then when it comes to your scripts, I know a lot of you, hopefully all of you, are using eScripts already because they are so good. One thing I never had to really train hardly. It was like everybody sees the advantage, I think. And then, of course, we were never supposed to get tokens. That was not part of the, is that right, Brenton? You're nodding. We were never supposed, you can turn your mic on. We were never
That
supposed
that
to
is
get,
correct. Yes,
yeah.
sorry. Yes,
And
spot
we
on.
definitely weren't. Were you working when we had to take photos of
Oh,
them during
yes.
COVID? Yeah. We
Oh,
were never
yes.
supposed to do that. So it was always supposed to be the active script list. Okay. And the idea of the active script list is that people can see all of their scripts rather than one individual token at a time, and we're managing it on our phones. It's all safe and secure on a list that the pharmacists can access for us. So of course, if patients have multiple medications, like if it's one medication, one token is not a big deal, still good. But if you're talking multiple medications, this is what we need. Anything to add there, Brenton? Our digital health, primary health network?
Well, the only thing to really add there is just a reminder that right now, unfortunately, still it's the case. Consumers, everyday Australians, it's an opt-in. It's not like My Health Record where it's opt-out. It's an opt-in script list, which means the only way to do that is you have to walk into your nearest pharmacy and register to activate it or switch it on. That's the step one. Then step two, the pharmacist is going to ask for consent for them to view it right there and then to dispense anything you're there to collect. And then you'll need to consent at every other pharmacy you visit to get access to it as well. So you can't yet still register at your GP, but your GP now can request consent to view it. But before they can do that, you have to register first at a pharmacy only. But yes, in fact, we're about to launch May, June, a massive campaign to educate on this across the primary care sector. And yeah, as you'll know with my podcasting program, Katrina, I actually did a wonderful interview with the team at Forbes, which will be published in a couple of weeks, where they now actually e-prescribe by default. They don't even ask the patient's permission for paper or e-script. They just do it by default, because when it comes to disaster management, they want to ensure that everyone in the community has equitable access to medications at a time of disaster, which in Forbes, flooding is a common occurrence. Cutting off access to medications is a regular thing. And so they've implemented by default e-prescribing at the community level, which is amazing. And seeing huge benefits. So yeah.
What I love about that, the pandemic taught us a lot, right? But we don't want to wait for something bad to happen till we go,
correct.
Oh my goodness, now we have to do this.
That's right.
So, yeah, that is wonderful. And what I hear from what Brenton just said, which I'm sure we can see the good in this, we're very big in Australia on consent. We don't just do things for people and say that you must do this. We're like, we consent and we educate them so they know what we're doing. And this is where we can get frustrated in a practice, because it's like people don't know about it. They don't understand it. And that then falls on you to do that educating. And I get that too. So one step at a time, just keep going with the educating. And as I've always said about all of the digital technologies, focus on the patients for whom it will benefit the most. If we're talking about, I'll just flick through this because, I'm sure you know it already and you're going to receive it. But think about, when you're thinking about advanced care plans, think about carers like me or my elderly mother. I'm sure many, many patients who would benefit from not having to manage their tokens. And maybe they do have a carer who can go and, help consent for my script list, and their active script list will be available. Okay. Now, did anybody come here today? I'm going to flick over to Brenton for a moment. Let's talk about secure messaging while we're on. I was thinking he wasn't going to be till a little bit later, so I moved my slides a bit later. But let's talk about secure messaging now, Brenton, because I could talk about AI for the next week, and maybe people don't want me to do that. So let me know in the chat, and let's talk about secure messaging, because I'm really keen to
Mm.
hear from you where we're up to, and I might just move ahead. I'll come back to these, don't worry, because I've got some slides I want to show you all. But I'll go to my secure messaging. Here we go. To streamline efficiencies, and I'll then come back to AI to go, all right, well, when we receive all that electronically, what's some cool new AI tools that we have available to help us file them in our medical director best practice systems? Okay.
Yeah,
So
yeah.
you want to take it away for this bit?
Yeah, sure. So I'm glad you asked me to talk about this because it's rapidly changing. For most people listening today, probably aware that there's been a lot of change. And in the context of the local PHN region, so for us, Western New South Wales and Far West, of course, when we're talking about secure messaging, we've got to think about all of the providers of care that traditionally referrers, GPs, are referring into. You've got your private specialists, you've got your public hospital, engaged outpatient unit, and you've got allied health services and things like that. The technology behind secure messaging is not changing anytime soon, but the landscape in terms of the tools and what the receiver of that referrer is using is paramount to your planning and operations and setup within the software. So some big announcements actually I can make today. And I'll be updating this in my update in a couple of weeks too via a webinar. But effectively, Orange and Bathurst Hospital will be going live with HealthLink e-referrals from July, much sooner than we had expected. And the other bit of surprise news, which I'm pretty sure I'm allowed to sort of talk about today, is that means that the engaged outpatient, the LHDs who are taking on patient referrals, will be axing the fax. So if you are actively using a fax right now, anywhere in Western New South Wales and Far West New South Wales, that it'll be turned off come July. So this is forewarning. If you are not actively using HealthLink smart forms right now to refer into New South Wales Health, then I suggest you get onto it pretty quick, because now there's a whole separate conversation about the statewide referral criteria, which is not for today's webinar. But the benefit of the smart form is, guess what? New South Wales Health have built in the referral criteria by default. So the referring GP doesn't need to think about it. They just need to follow the prompts in the 6 steps of the form, press send, and Bob's your uncle. It's as simple as that. Safe, secure, reliable, prevents transcription error, you name it. Now, that's the e-referral system through the public health unit, but don't forget within the HealthLink portal, some of you may have heard that HealthLink have just launched HealthLink Pro as a free trial for the month of April to give you a flavour of what that might look like, which is different to the standard HealthLink. But the HealthLink platform is the go-to for our region, the most preferred across the board, especially if you're accessing private specialists using the S&R tool. Again, it's the same web form, smart form technology, but it's a generic one that gets sent to private specialists. So at your fingertips in the same HealthLink window, you've got access to both private and a directory, a database. And that's the web form, smart form technology, was the most preferred and recommended where possible. It's what we call the risk mitigation consideration when sharing patient information for referral. It's the one that offers the lowest possible risk for security in using. And then you have your other option, of course, which is your HL7 send, using defined templates in letter writer, but making sure you're setting up your address book so that they have a HealthLink EDI programmed in there, so that your GPs can feel comfortable that when they're sending off that letter is going to be received. But that has to be operationally set up in your address book. First by admin support teams, so your GPs can send with confidence that it'll get through using that particular sending mechanism. That's sending it securely. That's locking it down. That's what we call an encrypted send and receive, and definitely the most preferred option. I won't go into too much detail, Katrina,
that's
as
great.
to what.
Thank you.
So the PHN, though, we are exploring launching this year another secure messaging system for PHN commission services. So when you're referring into the ITC program and hopefully the endo pain pelvic pain clinic locally in Orange, those sort of services where we commission, they will be requiring a smart form as well through the Consult Med system, and we're making announcements about that later in the year to again streamline safe and secure transfer of patient information across the system. Yep.
Fabulous. Thank you. That's really good news. And it's really about continual progress. You know, we can't wait for perfect is something I learned like 20 years ago, but we're very patient in health. And then go, okay, well, now we have this is new. And I have to say, I introduced smart forms as well, obviously, with everything that's new. People love them. And
that's right.
I work across Australia. So a lot of stuff is, as you know, it's different in regions, let alone states. And it's really interesting. You know, I was just training in South Australia. They don't have the fitness to drive smart form. Who uses
that's
just
right.
let us know who uses the fitness to drive smart form. So you
one thing I might just mention quickly, Katrina, actually, just because you tapped upon it very briefly then, is that for some of our practices who are bordering on states and have to refer patients into like Victoria, please pay attention to the Victorian landscape if you're sending patients across the border into Victoria. In particular, it's just been announced recently, some of those public health units in Victoria are now moving to either a Consult Med or something in the electronic secure messaging space. So pay attention to what's happening down there. We may not talk about a lot given our Western New South Wales Far West remit, but if you are sending patients into Mildura, Swan Hill, those sort of areas quite frequently, if you're in the southern parts, it's advised to pay very close attention to how they're looking to receive. And as we said, change is a constant, and in this space in particular, it's moving rapidly fast. So pay close attention to new news when that happens, so you can have the latest and greatest information for patient referrals.
Excellent. Is anyone feeling like it's moving too fast for them? Like there is just so much you got to keep up with? Let us know. I feel one of the things that we really need in our jobs is a change mindset. It's like I had to teach myself, I've learned to love it. It's like, oh, what's new? What's next? But, you know, it is hard to maintain that energy as practice leaders, I find. So that's going to be really important that you consider, okay, well, how do you lead with positivity, and how when there is constant change? And what Brent's talking about, which is what I agree with, is what's the beneficial new? What's going to be the biggest win? What are people going to love? So work to what's going to make a difference and going to be the best. And we'll keep throwing at you a whole lot of different ways that you can use digital technologies. And then you go, okay, well, that's the one. You know, if you're overwhelmed, just choose one. That's the one I'm going to try next. And then if you're in a general practice activity, you know, I was a practice manager, you know, we got to tick off more than one thing at a time. Do it as a quality improvement activity. And I'm going to talk about that when it comes to AI. But while we're looking at the secure messaging, and I know a lot of you told me you're using best practice, so I've got it here on the screen. I just wanted to make sure you knew that we do need to set up your address book. We do need to turn on the online directory. So in the configuration, and the goal will be that maximizing efficiency. You've got all your templates there. You've got if you're not using the smart forms, if it's another process, then you've got your wonderful templates that are more sophisticated, that are pulling in results or notes or accessing that up-to-date information from your medical record, and then that you're able to see that that's able to be sent electronically. Okay, and you can choose. All right, I'm going to go through the whole sending a referral. I'm going to go out the door. If you've ever done any of my training, you would have heard me say that a million times. Don't want to be in a screen? Go out the door. Now, I wanted to, so let us know. Look, you have all of us here. Let us know if you have any questions. Nat and Brenton from the PHM, we're here. So if anyone's got any questions or challenges, just let us know in the chat. We want to make sure that, you know, we can help with any unexpected, curveballs that you may be facing in your practices. I can't help myself because I am a trainer. I have to mention this. Two things here. One is that is screaming at me that there are unchecked reports for this patient. A lot of patients these days don't see the same doctor who ordered the test for their results. Clinical unchecked reports, or Alt F11, is a quick way to go to that doctor's inbox. So ensuring that your person hasn't come back and then missed a result, remembering that results are now potentially visible to patients on their My Health record. And then it's going to be so important to, when you give those results, that I guess, and this is just the era we're in. I mean, I can't imagine there is any of you who don't have patients who are coming in having Googled their symptoms, and now not only Google it, it's like ChatGPT has told them what you should be doing.
Actually, Karina, I might just take a second here, just while you're talking about investigations.
Yeah.
I mentioned the state referral criteria, New South Wales Health statewide. They've made some announcements already, and they're going to emphasise it even more over the coming months. But the new statewide referral criteria has been launched, was launched at the end of March. So if you haven't been onto their website to look at it, I highly recommend it. But probably the most important message they're passing on actually is that as part of referring patients into those services, if you do not attach the investigations, if you do not provide all of the evidence as to the reason for the referral and the diagnosis, they will be rejected. Okay, so I just want to emphasize that good clinical governance and workflow of getting your investigations under order, well documented, has to be sent with the referral. Those investigations are critically important. And if they are not embedded in the referral, the patient will not be triaged. Okay, so that is a very important message. I just wanted to instill that you've got to make sure, and that's why the smart forms are even more important, because that's going to be prompting the GP at the point of referral that those investigations it's mandated, must be attached, otherwise it won't go through. So it's putting that emphasis back on GPs to do the work, pull everything together before making that final referral.
That's good advice, because I've seen the other end of that, and it's brutal.
Yeah.
Like I've seen, and it was in Victoria somewhere, and they were saying to me, if we just miss one field, they just flat out reject our referral.
Correct.
And they were frustrated. So yeah, that's a good heads up that we need to, and I call that essential data. There are, certain aspects of our data that we do not need to necessarily put in the box. We can type whatever we like, but there is a lot that we need to actually click on the box and choose from the list, which is what we call coding. And then it might be, so what are they here for? So that is really, I think that's really important distinction in this, what a segue, in this era of AI, where now, and I want to hear from you again, is anybody using a scribe in their practice? And if so, which one? Let us know. I would be surprised, especially with best practice users, if we didn't have some who were perhaps using Lyrebird because it is included. Are you all eating lunch? I think you are. Well, I'm going to tell you about AI. You haven't told me that you particularly wanted to hear it like I normally hear, but I'm going to tell you what's happening with AI, and let me know if you've got any questions. Here's my favorite topic. But scribes have been like eScripts on steroids, adopted so fast. And again, like eScripts, speaks volumes. If the technology benefits clinicians, it's a no-brainer. They're going to do it. They're going to use it. What's going to be the benefit? And of course, that is time back with your patient. I mean, my GP loves it. She's like, can sit and look at me again, not having to finish notes after the visit. There's a lot of benefits. Of course, with any technology, there's a lot of risk mitigation that we need to do. And especially if you've been keeping up, you will know that it's well evidenced that scribes hallucinate. I mean, doctor last week told me that one had said her patient was naked and she was never naked. So I cannot stress enough, as a risk savvy approach, ensure that they're checked. But having said that, I can't even remember a technology that doctors loved as much as scribes. I think we're kind of moving on from scribes. Let's talk about what else could be of benefit to our practice. And there's task automation, which is seriously game changing. I feel like with AI, I could take my slide and make that so much better now. Now I was doing an event and I created a website using Claude AI in 5 minutes. It was unbelievable. People think I did it. I was like, I wasn't me, that was AI. So yeah, the potential is endless. The potential to feel overwhelmed is large too. So just let's go, when you look at it, what is going to be a win for your practice? Now, I always talk about AI, somebody who's worked in practices for all these years, I talk about AI to make sense to me there's lots and lots of different tools. I needed to think about it in terms of, well, this is pre-consult, before our patients attend, what are the tools, versus at the consult versus after. So when we're talking about pre-consult, there are now AI receptionists. And let us know if you're using any of the AI tools. Keen to hear. No vested interest with me. I'm a trainer, so I will mention some names if they come to mind. But there are AI reception tools that answer the phone, sound like a person, can speak different languages, and can make appointments, and then can give answers like, is there parking? So this is enabling receptionists to actually answer the phones if you can't keep up with the phones, and also to be able to spend more time with patients who may need a little bit more help. For non-GP specialist practices, they're even able to confirm appointments, call patients, give information. Amazing. So triage, and it's all of that. Yeah. Do you have chest pain, etc.? Answering the phone, confirming. So that's all just some of the pre-consult stage. With the consult stage, of course, we've talked about scribes. Now it's sort of moved on to being able to, generate those letters and care plans. So this is why when we're talking about this in context of what we've just been covering in this webinar, it's really important that we still enter that coded data that we're going to need to, one, be able to facilitate that referral process. So we're going to need the smart forms. We're going to need the data. So there is no point saying to, and what a scribe does is, of course, listen to the consultation and then captures that information in the progress notes for you. There's only one that is fully, well, not even fully, but more integrated, and that's Lyrebird. And by integration, what we're wanting and what we'll see developing over the years is the ability to not just put all the text into the progress notes, but to populate. Remember that 5 absolutely foundational data points. Are you Aboriginal or Torres Strait Islander? Allergies, medications, past history, immunizations. There is no point just free texting that in progress notes. That's a backward step. Okay, we need that coded. That's a safety that's going to warn give you prompts, help manage your chronic condition. Clinics, absolutely essential. So there's no point using a scribe to document that. That needs to go in the correct place. But all of the rest of the consultation, it's fabulous. So know that that clinical documentation, that's what I said, doctors are loving it. And there are, I've got quite a few free webinars. I'm doing one every month on AI, and they're on my website. They're free. I'm getting them sponsored because I know practices don't have any money. So I didn't want to have to charge anybody. So we got to keep up with this. Okay, just like we were talking about all of this digital technology. Let's just keep up. Then it doesn't become, oh my goodness, I'm so far behind. It's too hard. It's just like, all right, what's in it for me? What's going to make my life better? If you can't answer your phones, I'd be looking at that. Okay. If the doctors can't keep up with their progress notes or their clinical documentation is below the standard that is expected, or it's making clinical handover or communication difficult, yeah, start there. A lot of doctors are loving the MBS prompting that's in these scribes. So you have a whole conversation with the patient, and then, you're talking about multiple things, and there might be an ECG, or there might be a mental health care plan, or there might be chronic condition plan. It might be a pregnancy test. And then it just says, sounds like you might want to consider all these items. So MBS prompting is very popular. Again, not necessarily going to be 100% accurate because you know all the intricate rules of, or the MBS does go there. The clinical decision support and the evidence synthesis is just blows my mind. So being able to take all of that evidence and quickly surface it to help with your decision making, I think is just incredible. So this is just some of them. And of course, we've got, when it comes to mind, just your scribes, the really popular ones are going to be Lyrebird and Heidi. They're very popular. We've got AI Scribe, we've got MBS Pro, Medico, and when it comes to other, this list is huge, but just the after consult. I have been studying AI in the US because I have family in the US. I go over there every year and do a study tour, and it's enlightening. I like it also because they have a constitutional right to good service over there. So the expectations are very high. I don't necessarily like a lot of the insurance and billing and cost stuff, but the expectations of good service, and with that proving, so the data and the evidence to show. So if you go to a doctor over there, you're able to assess by infection rates. And yeah, so the data is next level, and the ideas for lifting that quality and service and having a clinic that your patient is going to choose is really fascinating to me. And one of the things I've studied with AI over there as it's emerged is they do something that we don't yet do as much in Australia, and that is including the patient in all of their information. So it is expected that the patients are going to have access to the medical record. It's expected at least that they get a generated summary of that consultation and what the plan is. And usually that's like even an SMS on their phone, and then that they're followed up and there's education. So the AI tool, when I went to my GP, I said, can I have a summary? And she was able to, I think she was using best practice, but I think they were using Heidi, and she just generated a summary for me. There was 5 errors in it. Okay, so this is what we all need to be aware of, including making me 10 kilos lighter than I am. which I'm pretty sure patients are going to notice. So know that it makes mistakes. So we need to be very careful because ultimately the clinicians are responsible for what is documented. So just a little note on what's going to be of benefit to you in your practice, monitoring compliance, the analytics it's able to surface for your practice. And then this one is in red because there's 3 things that are winning, that everybody is like needs first in my life. So I'm not saying it's for you, but I'm saying this is what people are going for. One is the AI receptionist to be able to answer the phone. Actually, one is scribes, then AI receptionist, then it is the inbox emailing allocation. So this is absolutely exciting to me because we looked at best practice and we looked at that inbox before. The scanning, hours a day people are doing. So yeah, it's better than filing hard copy files, which is what they used to do, but it still means they're unable to do something else that will help in the practice and care for patients, right? So being able to take being able to take all the documents that you scan from a folder and automatically allocate them. So automatically allocate them to the doctor, to the patient. Okay. And also label them. So it's not just going to say report, it reads it and puts some informative text in there. And remember, AI is trainable. So it's a learning model. So the goal is that it will take all of the documents from a folder that's where they have imported to. That's where you've put all the emails, or it's where you've scanned into. It'll take it from the folder and it will allocate it automatically for you. And if anything doesn't match, it just puts it in a separate area for you to check and allocate. Now so that's what I'm seeing that practices are absolutely loving. And there's 4 companies that are doing it. And they are Doc Deliver. This is a big pressure on my brain, isn't it? I'm going to write it down for you. Fair is another. And I'll think of it. There's 4. I think I'd be able to remember 4, wouldn't you? So know that is absolutely vital if you are drowning in scanning as a number 1 consideration. But even if you're just using AI such as ChatGPT, think about what you could do. Now, I just started this little list to go, all right, what else could we use it for in a practice? I only got to the practice managers list and I did that in about a minute. What could I use it for? Let alone receptionists, let alone doctors, let alone nurses. So the lists are going to look very different. And certainly policies is a big one that I get from practice managers wanting help. And of course, when we're talking about using AI, we need to be really careful that we're not putting any patient information, confidential patient information into it. Okay. So anyway, I could talk about this all day. I won't. This list is endless. Just start the conversation in your practice. I went back to practice management during COVID to help out. That's what it looked like. The scanning. That was the scanning pile. So if we can now take that away, secure messaging, clinician to clinician. We won't need the AI tool. It goes straight to the inbox. That's number 1. At least import the emails. Don't print them. If you are going to print to PDF and import instead. E-faxes should go straight to your inbox. Okay. And then importantly, make sure that your inbox or holding file management system is has got no holes in it, that it is safe, that doctors trust it, that everybody knows what happens when they action things, and that you have a risk savvy approach to making sure that nobody slips through the cracks. And if I have doctors on the webinar listening to this later, I can't help myself. I just have to use this as an opportunity to say the only way that this is absolutely finalized is by you selecting markers given or markers notified in the software. Okay, so that way we know that no more follow-up is required. And as somebody who works as a risk advisor and with, I just did I have to tell you, Brenton, I just did a podcast on with the, I can't remember what the name of the organization is, but it's where if they get a formal complaint about a doctor, it's the people who assess those complaints. They were wonderful doctors too. That was very nice to know. But this is absolutely vital that we have systems in place to protect you and patients, and nobody slips through the cracks. So, oh look, I did a QR code for you. There you go. If you want to join the webinar, that is for medical receptionists and practice managers. Okay, that is free. And if you are leading this in your practice, just what do you need? What are your goals? Make sure everybody's along with you, including patients. I had a doctor say to me, because consent is very important. She said to me, she had a patient who is fine with her using the scribe, but asked her to turn it off when he talks about his wife. So patients are going to, we're used to that sort of stuff. It's like, all right. Same with my health record. If you have a patient who does not want it, that's fine. It's a patient's choice. I would always just ensure they know that there are controls and they can set a PIN. I certainly have mine set as a PIN, and that's how I know that it's being accessed by the flying nurse squad at the aged care centre at times and the doctor at the hospital at times. So let's keep everybody in the loop as you go along with these improvements. Make sure everyone has training, that you're trialing things. Okay, you might trial a product and then go, this isn't helping. And then monitor the outcomes. Was that change an improvement? And embed the change. Okay, so Brenton did talk about secure messaging, but just in case this is new to anybody, I popped it in here. I also put in a little quality improvement template, because as you trial new changes, document it, tick off. We also get paid to do this. But one of the things I love about quality improvement is when you have a team meeting to discuss whatever new digital improvement is next, the only constant is change, get everyone's ideas, because the ideas are where the gold is. Right? So I'm saying, everyone, it's not me that has good ideas. I'm just with a lot of people. And there's evidence to show that this approach, the QI approach, leads positive change. So thank you, everyone. 1:31, I went over. Thank you for inviting me to present today. It's wonderful to be with you. Let's stay connected. I'm popping things on my website all the time. And I'd love to hear how you're going on your digital journey.
Thank you, Katrina. That was wonderful. And thanks also to Brenton for sharing some of his valuable insights there.
Thank you.
Also Ali for helping to coordinate this 1 hour session today. And
Very welcome, Nat.
no worries. And to everyone who joined, I hope you enjoyed that. As I said, this will appear on our website, so it will be there for future reference should you need to revisit. All right. Now I didn't prepare an evaluation before we came on today, so I will get that organised and send it out by email for you all tomorrow morning, if that's okay. If you could complete that and return. the feedback that you provide and helps us to plan and prepare for upcoming events in the future. So on that note, enjoy the rest of your day and thank you so much.